She has become one of the most important voices of information in the battle against the coronavirus, and her calm, steady approach is winning her national praise and respect. Dr. Amy Acton is the director of the Ohio Department of Health, and she joined us from Columbus. Dr. Acton, thanks for being with us. We appreciate it.
Oh, thank you so much.
You are in the middle of this. How are you?
I'm actually doing really well. I think I have to thank everyone out there. I feel buoyed by all the people out there who've reached out. I have an amazing team. I am not alone. You see me, but as I've said before, I'm the tip of the iceberg. So we have amazing people. We're working very hard. We're definitely, we've been working every day since about mid-January. So, you're tired, but I feel the absolute importance of what I'm doing. And so it gives me the energy, and I thank those of you out there who are sending that energy my way.
I know that many of us have had moments in the day where we have just lost it, just emotionally, as the weight of everything that's going on has hit us. I have to ask you, you're dealing with this 24/7. Do you ever have moments like that?
I do. I think I like to tell the truth, and I think I've said there have been moments that even I need some grace. We're debating some of the hardest policies that have ever been issued in sort of our modern era, and everyone is working so hard. There's no doubt there aren't moments where we have frustrations or just feelings of that everyone is having right now. It's a lot to take in. It's been a lot to get our heads around. I used to say early on, even I, knowing everything I know, would be driving to work, knowing that it's not life as normal, but still not being able to accept that. So I hope people are giving themselves some grace. Lori Chris, director of OMOS, our mental health agency, spoke during our press conference today. She had a lot of really wise tips and words that I hope everyone gets to see and follows up on some of the resources, because this is unprecedented. None of us can really fully get our minds around how quickly we've had to change our lives. But I can tell you, I hope you find some solace, as I do, that we're in this together, and that everything every one of us is doing is really making a difference. I see proof of it now, which is so encouraging. And I know we need to really reach out to each other, even virtually. We have to stay connected because we do need each other through this trying time. And I'm with you, feeling the same things you're feeling. And I'm feeling great sadness. I hope people understand there's not one of these death numbers that I say a number. It's not just a number. These are people who are ill and people who have died that are friends and family. And the more this goes on, the more it touches each of us. So it's something I feel with you.
Let me get the latest from you, if I can, Dr. Acton. At this point, when do you expect the number of cases in Ohio to peak?
We're still using our best modeling, unprecedented situation. So a lot like telling the weather, as I've said, it's sort of like a hurricane that's moving toward us. Because of the decisive, important actions we've all taken, we are able to delay that date it reaches us, and that gave us some great time to plan. We also know that it's decreasing the amount of us who are infected. So that's like going from a Category 5 hurricane to a Category 3 hurricane. We've done that collectively, and I hope each of us understands that. The dates are, it's ramping up daily. We're on that upslope. The peak is anywhere from end April. Perhaps, one number that's starting to salt out was around May 5th. So I've always said end April to mid-May. But so much could change that. How well we keep doing social distancing will change that peak. If there is some miracle treatment in a viral, that will be something that could change that. But I think that's a pretty good estimate, that would be a time where we might be reaching that peak. The better job we do, the farther that peak gets away, which is a good thing. So, I'll keep telling you the latest numbers as we know it.
When we talk about that peak, what kind of numbers are we talking about?
You know, we've seen some conservative modeling about numbers of cases per day. That was as high. The Cleveland Clinic originally had thought maybe 10,000 cases a day. Some of our modeling, it's always a range, was more like 6,000 to 8,000. The bottom line to this is that we'll never know all those cases. You won't see it in the cases we report number. We'll know this more after the fact because not everyone is being tested. A lot of the people who are cases in Ohio, they're not actually being reported to me. Often it's a primary care physician or provider who's saying, you have the symptoms and we want to treat you as if you've been diagnosed with COVID because the clinical picture says it, but we don't have enough testing to prove that. Someday, you know, we're gonna be able to go back and perhaps even have serologic blood testing to show that people develop the antibodies. But what we'll really be able to look at are numbers of hospitalizations and then numbers of people coming in our ICU. And so we'll be watching those numbers that are sort of proxies for the actual cases go up. And that's what we're seeing. And I think people should realize we're delayed, we're behind a New York, a California, a Louisiana, we're behind Detroit, which is peaking, behind Chicago, but we will peak. We hope to peak at the lowest possible numbers. We know that it's going to be a big surge on our healthcare system, and we're trying to, you know, build up, use every day we have before that those numbers really start ratcheting up to get better and better prepared, and that's how we spend our days.
As we speak today, what is your biggest concern about the future as we go through this?
Oh, there's so much on my mind. I would say that I really, really hope that everyone at home does everything they can within their control so that we protect the folks who have to be out there being more exposed. I worry with good weather. I worry just with our exhaustion of doing this, especially in this time before we're still in that sort of rain is picking up. We're not in the heat of the storm yet. It's sort of the same way evacuating for a hurricane. No matter how much you say, like, take the measures now while the sun is still out. You know, get off the island and get to the mainland now. We know that people linger. People don't believe that message. That worries me. It worries me that people will let up, and you can't in this. It's a longer haul as we're seeing now. We're looking truthfully that, you know, even peaking in the May time means we have to come down that curve, and we really can't relax what we're doing until we have steadied, we truly know the number of cases through good testing, till we have enough gear, till our hospitals have enough capacity. And when we go to the point where we start to pull back some of these measures, it will have to be done in a really, really deliberate way. So there is no quick, you know, a week from now solution, and I know that's hard for people to hear, but we will guide you every step of that way with the best recommendations.
I've heard you speak several times about the Spanish flu of 1918, which subsided somewhere in the summer of that year but came back in the fall. How concerned should we be that that could happen this time around as well?
You know, I think Dr. Fauci, head of the NIH part on respiratory illnesses, has said that some of what they're seeing in the data is that it will have surges. It will come back. It's until we have a vaccine, until we have immunity in our population, it's going to be a threat for us. And this is really going to be something we're dealing with over a couple years. But again, the more time we buy, the more we take these precautions now. We don't want to have a second surge now in June. And then the best science will guide us as we enter fall, what kind of precautions we need then. And every day they're fighting to get a vaccine. Every day they're testing to have an antiviral, which I think we could have sooner than we have a vaccine. You see that there are antibodies, serum from people, actual antibodies from people who have already fought off the disease. That's being looked at as a form of treatment. All those things could come in play, hopefully, before we get to having to deal with that in the fall.
Let me just make sure I understand something you just said. We could be dealing with this for 2 years?
You know, this virus isn't going to go away. It's going to spread. You can see in countries in Asia now, they're worried about it being reintroduced. Not their entire population was sick with this disease, and therefore there's still lots of folks who are able to catch it. And until we have a vaccine and actual population level immunity, those of us who haven't become sick in this first peak are still vulnerable. And that's why a vaccine is so very important.
Let me ask you some quick viewer questions. We put this out for viewers. We got, Dr. Acton, I want to say more than 1,000 questions. I'm just going to ask you a few of them. Very quick ones, if you don't mind. One person wrote in, I work in a grocery store. Do I need to wash my clothes as soon as I get home?
So everybody by this point, I hope, is washing their hands multiple times a day. And when you come home, that's a really great time to wash them again. Our clothes and surfaces can carry the virus. And so washing your laundry in warm water, hot water, and we have advice for that on our website, coronavirus.ohio.gov, is not a bad idea. What we know about the virus is it typically doesn't live for a long time. There's some debate about that, but certainly washing your clothes, and certainly if folks are sick, we have guidance on our website about washing your bedclothes and all of that. That's a good idea. But I think it's never a bad idea. Put on something clean for the next day and keep washing your clothes, keeping your house clean. We have lots of guidance on that. I want to remind people soap and water works. It's simple when you don't have hand sanitizer or any specialized cleaning fluid. But do try to keep things as clean as you can. Lots of guidance online.
Another question here. As a grocery store customer, how concerned should I be about the safety of the food I bring home?
So I would say any packaging is something you could certainly wipe off. Wash your hands, wipe off packages, including like take-home delivery food. That's something you can do if by chance the virus or someone has coughed or something's on that surface. I know a lot of people are taking wipes and things with them to the stores, and some of the stores are actually giving those out. I know they're cleaning stores quite a bit and taking a lot of measures to protect you. Something I think we'll be hearing about in the next few days, there's some kind of stir out there now. Dr. Fauci did say that the CDC is looking at guidance for the rest of us potentially wearing masks as something to protect yourself. I want to say something about that. Those N95s, those respirator masks, are really needed by our frontline healthcare workers right now. We have nursing home workers who are taking care of our family and our loved ones who don't have even the basic surgical masks. So if you happen to have come across some of those, keep a couple for yourself. You can repeat wear those. Those are really to keep us from coughing on each other and spreading respiratory droplets. But if you have a big stash of those, you really need to give them to a nursing home near you or a local health department. But a lot of people, even as far back as previous outbreaks, the CDC actually has guidance on using things like bandanas and masks. And you see that in other countries, that people really try to wear something when they're sick so that they don't spread it. So those homemade masks people are making could be used for something like that. So that's another thing you can do. It won't keep a virus from getting in, but it's a way, if you're at all sick or maybe in that asymptomatic period, any one of us might be, to keep you from spreading. So I think we'll be hearing more about that in days to come. But same thing with going out. If you're healthy, wash your hands.
Sure. I understand I don't have a whole lot of time with you, so let me just ask you a couple of quick questions here. What is this like for you? You have become a celebrity all over the internet, snacking with Acton. People can't wait till 2 o'clock every day to watch you and the governor. Personally, what is this like?
Well, I want to say, and I've said this from the beginning when the folks from Homage reached out, I'm the person you know now, and I am so grateful to the media's beginning to really tell so many stories. Our frontline responders, all the people behind me, every one of them and every one of you for taking these actions is doing some part. The little kid things mostly just about kill me. When they showed that video yesterday, you couldn't see me, but I bawled. What you're doing means a lot to me, and I'm grateful for the energy you're pouring out. And just keep on, I know on some of those fan pages, and I'm so busy I can't be on them, my husband plucks things for me and shares, and I'm astonished and grateful. But it's not me, it's you. So keep putting on those pages stories of the people around you and the things you're doing so that you can all learn from each other and we could spread good ideas.
There has been, as you know, some disconnect at times on the federal level between the government and health officials. However, when we see you and Governor DeWine, it appears that you're on the same page. Have you ever had disagreements on things, and how do you hash those out, if so?
Well, I am, again, I wasn't a politically involved person before this. I was minding my own business like most of your viewers are. And so I didn't know Governor DeWine until the day I got this amazing phone call. And right away, it was so clear to me just how deeply committed he is to Ohioans and how this was the job he had wanted his whole life. And every action I've seen since I've been here has been about that. So he is a prosecutor by mind. He digs deeply, he pushes me, he pushes all of us daily. He makes these hard decisions, and I have the honor of giving him the best advice I can. And we go round and round, but I do think there is a chemistry you probably are noticing. It just has come naturally. It's a gift, and our going out to the media was in an attempt to be as transparent and help people we never knew it would become. Wine with DeWine or snacking with Acton, that was never obviously an intention, but we will be there for you as long as you need us to be there for you, and we will share everything we can, and it's just an honor to work for him.
You've been incredibly optimistic throughout the course of this, but let me ask you, as a scientist, as a doctor, what hope can you offer the people of Ohio that things will get better?
You know, things will get better. Infectious diseases like these, they will come, and we will fight it, and we will eventually have a vaccine, and it will become a history story again. But we will have learned a lot in the wake of it. I think you'll see a lot of changes that take place, both in how we develop our public health and healthcare systems. You'll see changes in technology. You'll see changes in the ways we treat each other. I want you to have hope. And I feel hope even now in the thick of the storm, because I am seeing things that we have long forgotten, and ways of us treating each other in our busy lives that we have forgotten. But I have absolute hope that we will emerge from this stronger and better than we've ever been.
Dr. Amy Acton, Director of the Ohio Department of Health, all the best to you, and thank you so much for joining us.
Thank you. Be well.